cornerstone for treatment of autoimmune encephalitis is immunomodulatory therapy. So these are autoimmune diseases and they require aggressive therapy. So there are kind of two tiers of therapy that we think about. So the first line therapy is IVIG, steroids, and plasmapheresis. And these have been used both as monotherapy and in various combinations. One thing that's important to recognize is that there are no standardized recommendations for how to treat these conditions. So when you're reviewing the literature, you're going to see variable procedures that are used or treatments that are used, durations, and doses. For patients who fail first-line therapy, it's recommended you proceed to second-line therapy, and that involves Cellcept, Cytoxan, or rituximab. These are big medications, but this is a big disease. So you kind of work up depending on patients' response to therapy. The current recommendations are if patients are not responding within the first 4 weeks to showing some signs of improvement, that you escalate up to second-line therapy. One thing that's important to remember with these diseases is they don't get better quickly. So the average time to recovery is 14 months. And patients will continue to show improvement even 18 months out from their onset of disease. So what you're looking for is initial signs of some improvement. You're not necessarily looking for dramatic return to their previous state. And if they're not showing some initial signs pretty quickly, you want to move up to the stronger therapies, again, because early and aggressive therapy is really what leads to the best prognosis. For some patients with an NMDA receptor encephalitis, they have an associated tumor. In particular, ovarian teratomas have been associated. So removal of those tumors or looking for certain cancers is important, especially in females. But also in males, they can have testicular cancers, and multiple other cancers have been associated with this condition. Removal can be curative, but many of these patients actually require at least first-line therapy to really lead to recovery of their disease.